Hi, welcome to Monetizing Innovation. I'm John Holcomb. Innovation isn't just the big idea on the whiteboard, it's the hard decisions, the missed signals, and the leaders who keep moving forward anyway. This show dives into the real stories behind breakthroughs in life sciences, healthcare, and tech, how ideas become results, how teams align under pressure, and how strategy turns into execution. If you're building something bold looking for clarity to lead with confidence, you're in the right place. Press play and let's turn innovation to impact. We have a very special guest today, Dr. Brandon Colby. He is a medical geneticist, physician, and technologist redefining how the human genome is used to prevent disease and optimize health. As founder and CEO of sequencing.com, the world's largest whole genome sequencing and personalized health platform, he is transforming DNA into an intelligent AI-powered operating system for next generation medicine. Born with a rare genetic condition, Dr. Colby's work bridges patient experience and predictive medicine, making complex genomic data actionable, accessible, and clinically meaningful for individuals worldwide. He is the author of Outsmart Your Genes and a frequent media contributor on genomics, AI, and healthcare and longevity. Again, thank you for joining us on the show today. We're very pleased to have you, Dr. Colby. Dr. Colby, we really appreciate you being on.
I'm very much looking forward to the discussion, John. Thank you for having me.
Absolutely. You know, one of the things too, as we started this podcast for Monetizing Innovation, one of the things that we were really trying to reach out to were folks like yourself, you know, the real true innovators. And, you know, you have really a cross-functional expertise, right? You've actually studied medicine, you're in genomics, and you're also in the middle of running a business and all the challenges that come with it. I wonder if you'd just like to share a little bit more about your background and your journey that got you here to date.
Sure. Thank you for that intro. So my name is Brandon Colby. I'm the founder and CEO of sequencing.com. I very much was born into the field of genomics. I was born with a rare disease, rare genetic disease called epidermolysis bullosa simplex. It affects my skin, and it means that a mutation in my DNA makes my skin very temperature sensitive. So if I just walk a few blocks when it's very hot out, I'll have blisters on the bottoms of my feet for the next several days. And as a child, I was always sitting on the sidelines. I was always watching the other kids have fun, run around, play sports. I could never do that, and I would always ask my parents why I am different from everyone else, and the answer was always, it's because of a change in your genes. So from my earliest perception of the world, I knew I was who I was because of a change in my genes. But also, I was not very happy with this path that my genes had put me on. I always wanted to find some way to overcome that control. That very much led me into my passion for learning about genetics, about DNA. I went on to become a physician at Mount Sinai in New York City, focusing on preventive medicine and genetics. And after that, I earned my MBA from Stanford, and I've been involved for about the last 15 years in how to bring genetic technology to the forefront of a person's wellness and health journey, and how we can really, truly use the information contained within our genes to help us live a healthier, happier life.
Yeah, and that's such a phenomenal story too, because right, you do have that discipline of the medical training, the personal experience, the business side. What are some of the major steps that you see moving forward now that we have come so far with some of the genomic testing and actually some of the special work that you guys have? I understand that, you know, from a sequencing standpoint, you do far more than just the traditional ancestry or one of the other DNA tests. Could you elaborate on that for us?
Sure. So whole genome sequencing is a unique type of genetic test. It's quickly becoming the gold standard amongst healthcare professionals. It looks at 100% of your DNA. So we have about 30,000 genes. It looks at all those genes. There's a lot of space between the genes, the person's DNA. We look at all of that space that's there. We don't determine what is important and what's not Instead, we look at everything. So it's just getting the entire of your instructions for life, everything from the beginning to the end. It's very different than other genetic tests that traditionally they only look at about 0.1% of a person's DNA. So those genetic tests are usually really good if you're performing pharmacogenomic research, or you're looking at how pharmaceuticals could potentially impact a person's DNA. They're really good all genealogy and ancestry if you're interested in that type of information, but they're not really made for or very good for health analysis because they just miss so much information. When you think about it, it's only 0.1%. And those are the types of tests that companies like 23andMe, Ancestry, MyHeritage, that they utilize those types of tests. It's much less comprehensive. It provides enough information for services to run. Whole genome sequencing is very different. It's very much tailored for you can use this information today and going forward to make sure that you live your healthiest possible life.
Yeah, I think to your point, that's one of the things that seems to be truly powerful, right? Is being able to use it as a wellness tool to really help, now drive things that could improve your health, because now you know to target the right, information based on your genetics.
That is true. Yes. Yeah. And that's very much a lot of the education that we work on providing to people is the understanding of just how much we can do once we have access to your genetic information. There's a tremendous amount that we can learn in terms of what health issues may impact you, as well as what medications may impact you in different ways, but also what issues may be passed on to future generations. So what conditions, different diseases, and how best to potentially avoid those. Just by learning about them, you're already taking a tremendous step forward, shining light into what otherwise would be darkness. There's a tremendous amount that you could do with almost every condition once you understand your genetic risk to go and modify your overall risk. So modifying a lot of things about your environment, about your nutrition, about fitness, even about screening exams, how often you have screening exams with physicians, your overall risk, and to give you back a lot of that control, which for really the whole history of humankind, we have not had up until today, when now we could actually go and look at all of your DNA all at once and provide you very useful, actionable information.
Yeah, and that's so powerful. And I imagine with the work that you've been doing, and then also adopting some of the AI into the business, could you share some of that? Because that opens up also a whole new world of preventative medicine as well.
And AI really allows us to take leaps forward, whereas it would have taken maybe 6 months or a year. Now we could go and we could accomplish a lot. We really have found is that AI is not at a place right now where it can perform the analysis on its own. So you can't just feed it a DNA code and say, tell me what I need to do. There at that point, but what it is very excellent at providing is taking the analysis that this platform provides. So in terms of a risk for a certain disease, and then providing information around that disease. What is the disease? What are the next steps you could do to empower yourself with this information? If you want to dig into the next steps, it could have an ongoing conversation about it where the AI never gets tired. So you could ask whatever questions you want at any time of the day or night, and it will always be there. So it's really that layer of reporting, of explanation, of guidance AI provides, which is tremendous to just the analysis that we perform, and then you add an AI layer on top of that. It really takes you much further than we've been able to go in the past.
No, I think that's amazing, and it really opens up the doors, right, to all sorts of treatment. Do you also see this offering potential to, say, folks that are sometimes in those healthcare deserts, where if they do have some conditions, but the specialist might be 2 hours away, does that also help to give treatment plans that can advance some of that care as well? Yeah, sorry.
Yes, yeah. So it certainly does give insight, some of that empowerment back to the individual, that they can start to learn about what's in their DNA, about next steps to take. There's a lot of things that people can do. I mentioned nutrition, different fitness, that's all personalized. AI can now provide based on the results of a person's genetic analysis. All of that is possible for a person to go and assimilate, to learn about, to read about, and to actually start to act on. Even if they're in a type of desert region where it's very difficult for them to get to a medical center or an academic center that has top doctors, now a person can take back a lot of for themselves and be empowered with this information to learn about it themselves right from their own home.
Well, that's very exciting. I think it opens up so much of the possibility for us. As we look at some of the work too, I understand that you're also trying to look at some of the women's group to help utilize this. Could you speak about that a little bit too, in terms of how this is now being used to help that organization?
Yes, well, we partnered with True Women's Health, which is in the Midwest in the U.S., especially out of Michigan. They are providing services that focus on really different conditions and how to keep a woman as healthy as possible throughout all stages of her life. Are working with True Women's Health to provide the genetic data layer for their platform. So as they're providing guidance, as they're providing personalized services, they're empowered. The physicians who work for True Women's Health are empowered with this information, with the genetic information about each of their patients, so that they could create a much more personalized plan. They see each person as a unique individual, as opposed to just grouping people into buckets, which is what medicine usually has done traditionally for most people. So it allows them to now really focus on providing truly personalized care. And we're very proud of our partnership with True Women's Health.
No, I think that's just a great example of how powerful, right, these new tools are and the work that you and the team have developed. As you look at your journey too, especially in terms of building sequencing.com and getting that started, what were some of the leadership challenges you ran into, from kind of the early start to where you are now?
Yeah, I think the most, in terms of one of the hardest parts, is just discipline. A lot of discipline is knowing what not to build. We gone through so many different iterations, ideas. People have great ideas, but are not able to go and move those into something will be actionable for our customers. So it's having the discipline to understand what is going to be most impactful for both from the business perspective, but also from our customer perspectives. Then also what we can really build, we could bring to fruition. A lot of the ideas and the product that we're able to go and put in front of customers now was not even possible 2 or 3 years ago, because it was just not as advanced as it is today. So we've really come a far way. Also, the price of whole genome sequencing has come down tremendously year over year, just over the past 3 years. That now makes it a lot more accessible to the everyday person than it ever has. It's knowing what is possible today, what we hope to do tomorrow, but for today, it's having that discipline to really build what is going to be most impactful today while planning for tomorrow.
No, absolutely. And I think that's such an amazing learning too, because I think often entrepreneurs, that's where they struggle, right? Is making sure that they have the discipline to go after what the customer really needs and what the market really needs. And so Sounds like you guys have been right in the thick of being able to do that, which is fantastic. As you think about other innovators and health innovators that are out there, do you have any recommendations? Because, healthcare tends to be so regulated. There's a lot of challenges that are just part of the structure. What are some of the insights that you have, especially from your journey thus far?
Yeah, I think that really revolves around understanding your true north. Making sure that the team is focused on the true north, the product that you're building is focused on that, the company success metrics are focused on that. For us at sequencing.com, our true north is the customer. Everything that we do is very customer centric, focused on providing as much value for the customer. And that means, as I mentioned in the last question, the products we built, how is that going to impact the customer? For the company's success metrics, those are all based around, is the customer obtaining value from this product? Once you go and you start to identify that true north, it helps to align everything else about how you're performing as a company, what products you're focused on, even the culture of the team itself. Can start to align to that true north. So it's really identifying what that true north is and adhering to it. It may change over time, but at least understanding where it is for you right now can help very much in setting everything else up for success.
No, I think that's such great advice because there's so much that you're doing in the early stages, right? And if you don't have that common true north and having folks really aligned, it's easy to lose your way. I think that's just great insight for any entrepreneur. When you think about some of the things that are coming up as well, I know there's a lot of activity in the marketplace too. Would you like to speak about February and some of the significance that might mean to your organization?
February is a month that is very close to my own heart and passion. It is Rare Disease Day at February. For sequencing.com, we have turned that into Rare Disease Month. That's an entire month that we devote to focusing on how whole genome sequencing can identify, start to provide very clear guidance around rare diseases. There are a lot of people in the world that are on what's called a diagnostic odyssey, where they know that there's something going on with themselves health-wise. They have symptoms. A lot of times it's non-specific. They've been to doctors. The traditional medical establishment, unfortunately, has not been helpful. Many of these individuals go on to be diagnosed with a rare disease. Whole genome sequencing is just so powerful because we could look at now almost every single rare disease that is known on a genetic level, analyze it all at the same time with whole genome sequencing data. So it makes it very powerful. It was able to identify the genetic cause of disease of epidermolysis bullosa simplex, and we're seeing more and more it helps people who are on this diagnostic odyssey by the genetic causes of conditions that they had never even heard of before. But since we're able to just go and look at everything that's known on a genetic level, it's helping to pull out of the haystack. And we're very proud to really help to promote whole genome sequencing and to offer free whole genome sequencing for some families in need. So families that unable to go and pay for whole genome sequencing that have financial constraints. We do have programs throughout February. It's an initiative called Families in Need, where we will go and we will offer whole genome sequencing for those individuals.
That is so fantastic, and what a great cause. So hopefully we can continue to promote that as well. I think with the audience, I know speaking from personal experience, I know my kids have had some challenges over the years, and I think anybody that's gone through that diagnostic challenge, right? It can be a nightmare, and it's so exciting that now we have a tool that can really help us understand what's going on faster and get the right treatment. So,
yes, it really has the potential to change the entire landscape of medicine. We can now be empowered by our genetic information as opposed to it just being We can shine light into that darkness, and we could really take back a lot of the power ourselves that our genes have always put us on a path, but now we can find out what that path is and decide if we're not happy with that path, let's go and modify that, change that path before it gets to some endpoint such as a disease occurring.
Absolutely. That's just so powerful and so exciting. Can't thank you enough for all the work that you and the team have done. I think it's an exciting example too, right, of now how we can take these technologies combined with AI and create some really positive change. So yeah, very exciting from that front. Are there any other key highlights that you would like to help make sure that folks are aware, especially knowing with February coming up, things that we might be able to do to help support you in the organization?
That the whole genome sequencing is really here, and this technology, most of us have heard about the Human Genome Project back in the early 2000s. It was completed about 2001, 2003. That was the first time a person was sequenced. It cost more than $1 billion to sequence the first person. Now we can do it for far less than even the price of an iPhone. We could go and we could sequence someone's whole genome. So this technology is while it's new, it has come down tremendously in price. Potential it has to change your health, to change everyone's health, is enormous. We look forward to being there right by your side in terms of sequencing and helping you access your DNA, but most importantly, learn what you can do with that information throughout the rest of your life so you can live as healthy as possible.
No, absolutely. That's wonderful. Well, Dr. Colby, this has been such a wonderful discussion too. One of the things I wanted to just check with you to see if there was anything else that you really wanted to make sure you were able to share or make sure the audience knows with, the capabilities and the future direction that you might be taking.
That February is Rare Disease Month for us, and we hope that people will participate in Rare Disease Month in understanding their own genome, understanding what diseases they may carry. So they may not have any symptoms at all, but they may pass on different diseases to future generations. We can now identify that even before a person has children just by looking at their DNA. So we hope that people will participate in Rare Disease Month and also to follow along at sequencing.com as we provide more information about our Families in Need initiative, and we offer whole genome sequencing. We donate that to families that are unable to afford it, but have a clear need that it could very much benefit themselves, their loved ones. So people will stay tuned and follow sequencing.com for our Families in Need initiative and how we are trying to go and make a very notable impact upon society throughout Rare Disease Month.
Oh, that's fantastic. And, I just want to thank you again too for your sharing your personal story and the journey that got you to really drive in this direction and the team that you've brought together. Really enjoyed our conversation and look forward to having hopefully many more.
Thank you so much, John. It's very good to be on your show.
Excellent. No, thank you so much. Take care.
Thank you. Have a good day.